Long-term consequences of child abuse and neglect. Aside from the immediate physical injuries children can experience through maltreatment, a child's reactions to abuse or neglect can have lifelong and even intergenerational impacts. Childhood maltreatment can be linked to later physical, psychological, and behavioral consequences, as well as costs to society as a whole. These consequences may be independent of each other, but they also may be interrelated. For example, abuse or neglect may stunt physical development of the child's brain and lead to psychological problems such as low self-esteem, which could later lead to high-risk behaviors such as substance abuse. The outcomes for each child may vary widely and are affected by a combination of factors, including the child's age and developmental status when the maltreatment occurred, the type, frequency, duration, and severity of the maltreatment, and the relationship between the child and the perpetrator. Additionally, children who experience maltreatment often are affected by other adverse experiences. For example, parental substance abuse, domestic violence, poverty, which can make it difficult to separate the unique effects of maltreatment. This video will explain the long-term physical, psychological, behavioral, and societal consequences of child abuse and neglect and provides an overview of adverse childhood experiences, parentheses ACEs. It also discusses the importance of prevention and intervention efforts and promoting protective relationships. Okay, let's first talk about physical health consequences. Some long-term physical health effects of abuse or neglect may occur immediately, for example, brain damage caused by head trauma, but others can take months or years to emerge or be detectable. There is a straightforward link between physical abuse and physical health, but it is also important to recognize that maltreatment of any type can cause long-term physical consequences. Childhood maltreatment has been linked to higher risk for a wide range of long-term and/or future health problems, including but not limited to diabetes, lung disease, malnutrition, vision problems, functional limitations, heart attack, arthritis, back problems, high blood pressure, brain damage, migraine headaches, chronic bronchitis, emphysema, chronic obstructive pulmonary disease, cancer, stroke, bowel disease, chronic fatigue syndrome. Child abuse and neglect has also been associated with certain regions of the brain failing to form, function, or grow properly. For example, a history of maltreatment may be correlated with reduced volume and overall brain size and may affect the size and/or functioning of the following brain regions. First is the amygdala, which is key to processing emotions. Second, hippocampus, which is central to learning and memory. Third, orbitofrontal cortex, which is responsible for reinforcement-based decision-making and emotion regulation. 4, the cerebellum, which helps coordinate motor behavior and executive functioning. And 5, the corpus callosum, which is responsible for left brain, right brain communication and other processes, for example, arousal, emotion, and higher cognitive abilities. Fortunately, however, there is promising evidence that children's brains may be able to recover with the help of appropriate interventions. Additionally, the type of maltreatment a child experiences can increase the risk for specific physical health conditions. For example, one study found that children who experienced neglect were at increased risk for diabetes, poorer lung functioning, and vision and oral health problems. Children who had been physically abused were at higher risk for diabetes and malnutrition. Children who were victims of sexual abuse were more likely to contract hepatitis C and HIV. Okay, now let's talk briefly about epigenetics. Epigenetics refers to changes in how an individual's genes are expressed and used, which may be temporary or permanent. These changes can be passed on to the person's children. An epigenetic change can be caused by life experiences, such as child maltreatment or substance exposure. For example, one study found that children who had been maltreated exhibited changes in genes associated with various physical and psychological disorders, such as cancer, cardiovascular disease, immune disorders, schizophrenia, bipolar disorder, and depression. Okay, so now let's talk about psychological consequences. Child abuse and neglect can cause a variety of psychological problems. Maltreatment can cause victims to feel isolation, fear, and distrust, which can translate into lifelong psychological consequences that can manifest as educational difficulties, low self-esteem, depression, and trouble forming and maintaining relationships. Researchers have identified links between child abuse and neglect and the following psychological outcomes. The first is diminished executive functioning and cognitive skills. Disrupted brain development as a result of maltreatment can cause impairments to the brain's executive functions, which is working memory, self-control, and cognitive flexibility. For example, the ability to look at things and situations from different perspectives. Children who are maltreated also are at risk for further cognitive problems, including difficulties learning and paying attention. Okay, the second psychological consequence I want to talk about is poor mental and emotional health. Experiencing childhood maltreatment is a risk factor for depression, anxiety, and other psychiatric disorders throughout adulthood. Studies have found that adults with a history of ACEs had a higher prevalence of suicide attempts than those who did not. Further, adults with major depression who experienced abuse as children had poorer response outcomes to antidepressant treatment, especially if the maltreatment occurred when they were aged 7 or younger. Okay, the third type of psychological consequence is attachment and social difficulties. Infants in foster care who have experienced maltreatment followed by disruptions in early caregiving can develop attachment disorders. Attachment disorders can negatively affect a child's ability to form positive peer, social, or romantic relationships later in life. Additionally, children who experience abuse or neglect are more likely to develop antisocial traits as they grow up, which can lead to criminal behavior in adulthood. Okay, the next psychological consequence is post-traumatic stress. Children who experienced abuse or neglect can develop post-traumatic stress disorder, PTSD for short, which is characterized by symptoms such as persistent re-experiencing of the traumatic events related to the abuse, avoiding people, places, and events that are associated with their maltreatment, feeling fear, horror, anger, guilt, or shame, startling easily, and exhibiting hypervigilance, irritability, or other changes in mood. PTSD in children can lead to depression, suicidal behavior, substance abuse, and oppositional or defiant behaviors well into adulthood, which can affect their ability to succeed in school and create and nurture important relationships. Okay, now I'm going to talk about something called toxic stress. Toxic stress is strong, frequent, or prolonged activation of a person's stress response system, often referred to as toxic stress, which can have long-lasting, damaging effects on an individual's health, behavior, and ability to learn. Toxic stress can be caused by experiencing ACEs, including child maltreatment. It can change an individual's brain architecture, which can cause the person's stress response system to be triggered more frequently and for longer periods of time and place him or her at an increased risk for a variety of physical and mental health problems, including cardiovascular disease, depression, and anxiety. Trauma-informed approaches, however, can help improve outcomes for individuals affected by toxic stress, and there is evidence that social and emotional support, for example, consistent parenting practices, community supports, can alleviate its effect. Okay? Now let's switch gears and go into behavioral consequences. Victims of child abuse and neglect often exhibit behavioral difficulties even after the maltreatment ends. The following are examples of how maltreatment can affect individuals' behaviors as adolescents and adults. First is unhealthy sexual practices. Studies suggest that abused or neglected children are more likely to engage in sexual risk-taking as they reach adolescence, including a higher number of sexual partners, earlier initiation of sexual behavior, and transactional sex. For example, sex exchange for money, gifts, or other material support, which increases their chances of contracting a sexually transmitted disease. Okay, the second type of behavioral consequence is juvenile delinquency leading to adult criminality. Several studies have documented the correlation between child maltreatment and future juvenile delinquency and criminal activities. According to the research funded by the National Institute of Justice within the U.S. Department of Justice, Office of Justice Programs, children who experience maltreatment in the form of physical and emotional abuse are more likely to develop antisocial behaviors and form relationships with other antisocial people. Furthermore, there is a difference between girls and boys in the way child maltreatment influences delinquent behavior. In a study, girls tended to express internalizing behaviors, for example, depression, social withdrawal, anxiety, while boys tended to express externalizing behaviors, for example, bullying, aggression, hostility, leading up to adult criminal behavior. Okay, the third type of behavioral consequence is alcohol and other drug use. Adults who have been maltreated as children are at a significantly higher risk of substance use disorders than adults who have not been maltreated. Okay, the fourth type of behavioral consequence is future perpetration of maltreatment. Although most children who have experienced abuse and neglect do not go on to abuse or neglect their own children, research suggests they are more likely to do so compared to children who were not maltreated. This cycle of maltreatment can be a result of children learning early on that physical abuse or neglect is an appropriate way to parent. Okay, now let's get away from behavioral consequences and talk about societal consequences. Although the physical, psychological, and behavioral consequences of child abuse and neglect weigh heavily on the shoulders of the children who experience it, the impact of maltreatment does not end there. Society pays a price for child abuse and neglect in both direct costs, for example, hospitalizations and foster care payments, and indirect costs, for example, long-term care, lost productivity at school, juvenile and criminal justice systems costs. A study by researchers from the Centers for Disease Control and Prevention developed estimates using 2015 data for the cost of child maltreatment in the United States. For non-fatal incidents of child maltreatment, the researchers estimated a lifetime cost of $831,000 per child, or for fatal incidents of child maltreatment, it estimated a lifetime cost of $16.6 million per child. It appraised the annual cost of non-fatal child maltreatment in the United States to be $428 billion. This is based on the number of substantiated cases of non-fatal maltreatment, or $2 trillion based on the number of investigated instances of non-fatal maltreatment. The costs in this study include both tangible costs, for example, child welfare, healthcare, juvenile justice, and intangible costs, for example, pain, suffering, and grief. Okay? Now that was societal consequences, so let's go talk about federal research on adverse childhood experiences. ACEs, that's Adverse Childhood Experiences, refers to a group of traumatic experiences in childhood, including maltreatment, that can cause toxic stress and affect an individual's physical, psychological, and behavioral well-being. Between 1995 and 1997, the CDC, in collaboration with Kaiser Permanente's Health Appraisal Clinic, conducted the landmark ACE study, which examined the correlation between childhood trauma and adult health and well-being outcomes. Research that explores ACEs and how to respond to them is still ongoing. Findings from a subsequent study showed that nearly half of children in the United States experienced at least one ACE, and that about 1 in 10 had experienced 3 or more ACEs. Okay, so right now what we have is the ACE pyramid. It's a figure. At the bottom of the pyramid is conception, and the very tippy top of the pyramid is early death. Now, starting at this first tier of the pyramid, and it's a 8-tier pyramid, starting at the lowest tier, this explains what's known as the mechanism by which adverse childhood experiences influence health and well-being throughout the lifespan. The lowest tier on the pyramid is generational embodiment / historical trauma. Second tier is social conditions / local context. Third tier, adverse childhood experiences. Fourth, disrupted neurodevelopment. Fifth, social, emotional, and cognitive impairment. After that, the next tier is adoption of health risk behavior. Above that is disease, disability, and social problems. And the very last tier of the pyramid is early death. Now moving on, promising evidence-based strategies have emerged to help combat the effects of ACEs on future outcomes and well-being. These include enlisting communities to promote stable, safe, and nurturing environments for children, using data to inform programs and services for preventing child maltreatment, and implementing community efforts that support parenting programs and positive parenting behaviors. Okay, now we're going to move away from federal research on adverse childhood experiences and move into preventing and reducing the long-term consequences of maltreatment. By reducing the incidence of child abuse and neglect through primary prevention approaches and providing comprehensive trauma-informed care when it does occur, communities can limit its long-term consequences. In trauma-informed care, service professionals acknowledge a child's history of trauma and how that trauma can have an impact on the symptoms or consequences being experienced by the child. Communities can also promote a variety of protective factors for children. Protective factors are conditions or attributes of individuals, families, communities, or society that promote well-being and reduce the risk for negative outcomes, including the long-term consequences discussed in this video. Now, research has shown that the following are protective factors for victims of child maltreatment. And we're going to speak at the individual level, the relationship level, and community level. At the individual level, the first is sense of purpose. Next factor at the individual level is agency. Then self-regulation skills, relational skills, problem-solving skills, and involvement in positive activities. And that's the individual level. Now at the relationship level, there are parenting competencies, positive peers, and parent or caregiver well-being. Now that was the relationship level. Now at the community level, a positive school environment, stable living situation, and positive community environment. So in terms of risk and protective factors, one way to, a helpful analogy would be to imagine risk factors are the falling rain, and protective factors is what makes up an umbrella, shielding the person from the rain, which is the risk factors. So risk factors, of the risk factors, think of the raindrops. One raindrop might be parental stress, another raindrop could be substance use, another raindrop poverty, and so on and so on and so on. Now, under protective factors, these are the parts making up the umbrella. Parts of the umbrella would include parental resilience, nurturing and attachment, knowledge of parenting and child development, concrete support in times of need, social connections, social emotional competence of children. So, in conclusion, child abuse and neglect can have devastating and long-lasting effects on a child and can result in detrimental social impacts, including high costs for services and increased involvement in the juvenile and criminal justice systems. However, communities can act to stem the effects of maltreatment and even prevent it. Evidence-based services and supports can promote protective factors that mitigate the effects of maltreatment, as well as provide families and communities with the tools to stop maltreatment before it occurs. Child welfare agencies can work with families and communities to spearhead initiatives that build upon strengths and address. Okay, citation, childwelfare.gov/pub PDFs/long_term_ consequences.pdf. Thank you for listening.